Well, as Susan said, it is Rally for Red Day, and that means we get the chance to talk with a Mayo Clinic cardiologist about heart health. And today, we're talking about mitral valve prolapse. Well, if you have it, you know what that means. But if you don't, it could be an issue, and you don't even know it. I want you to meet Dr. Harry Chaliki. He's a Mayo Clinic cardiologist, and he's here really to show us what's happening inside of our heart when you have MVP. I broke that down for us. And it's true, Dr. Chaliki, you may not even know that you have this situation. Before we talk about it, I want to show an animation of the heart we just looked at. Kind of explain what this is.
Sure. So as you can see at the animation there, mitral valve has two leaflets. If either one or two of the leaflets prolapse back into the left atrium, that's what's called mitral valve prolapse.
Okay, so it's possible, though, that you may not know that this is happening inside your heart. How is that possible?
Yeah, so the normal valves can have a little bit of leak, and people don't have any symptoms from that. And sometimes it can leak a lot as well.
Okay.
So unless the heart overworks, people may not notice any symptoms with this disease. So depending on how bad the leak is, what we call regurgitation, that's what causes the problem with the mitral valve prolapse.
So depending on how bad that leak is, depends on then what kind of treatment options that you need to do. Is there a sign, or there symptoms that we might experience to tell us that we have this leakage?
Yeah, like what we talked about, some people may not know that they have it. Sometimes people may have palpitations or racing of the heart.
Okay.
And if it is bad enough, it can also cause shortness of breath.
Oh, okay.
And so those are the symptoms to watch for if you have it. But sometimes people may examine you, and the doctors may feel that you have a click or a murmur. That's how you come to medical attention. So once we know you have it, then it needs to be monitored.
Okay.
So that it doesn't get bad enough that that it's too late to do surgery and things like that.
Okay. So if you have it, it's not necessary that you would need surgery right off the bat. It's more of a monitoring situation. I want to show some other video, and this is an actual heart, and this is what it looks like when you. What are we seeing here? Are we seeing it like misfire?
Yeah, so in this animation here, it's somebody's heart actually. So mitral valve has two leaflets, the one in the front up top and then one at the bottom. It's called posterior leaflet. So it's an ultrasound test of the heart with a three-dimensional view of the mitral valve, as if the surgeon or the person looking at the mitral valve from the top.
I see.
And the one at the bottom is called the posterior leaflet that's actually prolapsing into the left atrium.
Wow.
So that's why the diagnosis of mitral valve prolapse in this patient.
And this is done through an ultrasound?
Ultrasound machine that this is acquired.
Is that one of the treatments that you would do to somebody who comes in and experiencing some of these symptoms? Would you require an ultrasound to find out if it's serious?
Yes, ultrasound is to diagnose whether or not you have it and how bad is the leak and how bad is the prolapse. So ultrasound by itself is not the treatment. It is to diagnose how bad is the condition.
Yes, I meant that, not treatment. I meant, yes, thank you for saying that. Well, you know what, that's pretty fascinating. I mean, the good news is, you know, if you are experiencing any of those symptoms, you know, you've obviously got to call your doctor and find out, you know, just how serious it is. And I want to tell you about a symposium that's coming up. It's called the Heart Rhythm Symposium, and it's going to be held on Saturday, May 14th. And patients with heart rhythm issues and their families are invited to really attend this symposium and learn about new treatments and technologies that are used to manage some of those issues. All right, for more information or to schedule an appointment with a Mayo Clinic cardiologist, thank you very much, Dr. Chaliki. Here's the number to call, 480-301-8200, or visit mayoclinic.org. And don't forget, ABC 15 teams up with Mayo Clinic every month for the Rally for Red campaign. And each month, we're going to give you easy-to-follow recipes and ideas to help keep you and your loved ones heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred.